Greetings. I'm Dr. Isaac Alexis from the Slim Samurai Group 84, helping you to slash through sickness and offering you a slice of health and wellness. Today's topic is Opioid Epidemic, COVID-19, California, and Naltrexone. I'm going to establish how critically important these three topics are. Now, I just want to begin by saying, parents, know what your children are doing. Opioids affect everyone. Some 140 people dying every year. 140 people dying, every day. With one death being way too many. So let me tell you something, what's been happening over in California. You got Alameda County, you got San Francisco County, you got Santa Clara County. In particular, in Santa Clara, deaths in teenagers are skyrocketing. And I'm going to get into that right now and what we could do about that. I talk about how opioid epidemic affects us both globally, but also nationally. And over the next few weeks, we're going to look at it from a state-by-state perspective. Now, overall, more than 20% more people died last year in Santa Clara County than in 2018 or 19, according to the California Department of Health. Of course, as you know, the COVID-19 pandemic exacerbates opioid use and overdoses. But strikingly, most of these deaths were not due to COVID-19. Of the 2,109 deaths in Santa Clara County, 932 have been attributed to COVID-19, while more than half, 1,177 deaths, were due to drug overdoses. Now, a lot of the opioids have moved from being on the streets to now being online, with countries of origin being Mexico and China. And a lot of these opioids, the kids are taking it thinking that it's a simple OxyContin, but it's actually fentanyl in disguise. It's a blue pill, and it has the letter M as in Mary and the number 30. I'll have that in the photos. And when you see this, this is not just OxyContin. This actually can have lethal components of fentanyl. It just takes 2 milligrams of fentanyl to just wipe you out, with fentanyl being 100 times more potent than morphine. Carfentanil, which sometimes can be found in this as well, being not 100, not 1,000, but 10,000 times more potent than morphine. I know, parents, it's hard to be up in your kid's business, but this is literally a matter of life and death. I'm a parent of teenagers. I'm sure that millions of you watching are also parents of teenagers and preteens and young folk. I say this as one parent to another. Get into your children's business, hang out with them more, create an atmosphere and environment where they feel free to come to tell you anything. And if you have to, yes, look in that purse, look in that wallet. It may literally save their life. Nosiness will lead to the next, as in you get to see them for the next day. So it's okay. I'm going to be honest and say I make sure I look in my children's property as best as I can. I want them to be safe. Now, you may be saying, so what to do? We're going to tell you what to do. We're going to look at one medication in a series of medications. We're going to start off with looking at naltrexone. Now, oral naltrexone at 25 milligrams per day for 2 to 3 days can be initiated before increasing to 50 milligrams a day. The medication can be started 7 to 10 days after the last opioid usage. Long-acting injectable naltrexone has been found to be more effective than placebo for opioid dependence in the randomized trials. An open-label trial among those with opioid use disorders who were initially withdrawn from opioids as inpatients and stabilized on oral naltrexone, who were then randomized to either stay on that formulation or to receive a long-acting injectable naltrexone, and then followed as outpatients for 6 months, showed higher rates of treatment retention for long-acting injectable naltrexone at 57% as compared to oral naltrexone at 28%. The depot formulation of naltrexone can be given every 4 weeks by deep intramuscular injection in the gluteal muscles, basically the butt muscles in layman's terms, at 380 milligrams intramuscularly per injection. Now, according to the American Society of Addiction Medicine family, they had suggested that if there's breakthrough increased cravings, then it can be given every 3 weeks. However, there's no current studies to back that practice. Now, very important, one must say, before beginning any type of treatment with naltrexone, you have to begin a naloxone challenge test to make sure that the patient has completed withdrawal from opioids and is no longer physically dependent on this class of drugs. The patient should be totally free of spontaneous opioid withdrawal signs and symptoms at the start of the naloxone challenge session. You must, very important, obtain baseline vital signs before beginning the naloxone challenge test. The naloxone can be given either under the skin, called subcutaneous, intramuscularly, or intravenously. You give small doses, about 0.1 to 0.2 milligrams, up to a maximum of 0.8 milligrams. You observe for 1 hour. And I would suggest using a validated withdrawal scale known as the COWS, Clinical Opioid Withdrawal Scale. Now, if any symptoms or signs of an opioid withdrawal begin, for instance, increased blood pressure, increased pulse rate, massive amounts of sweating, then the administration of this naltrexone, you want to hold off on that for another 24 hours. But if you gave the naltrexone those withdrawal symptomologies, not to worry. Naloxone has a relatively short half-life. Any withdrawal precipitated by naloxone typically will resolve in 1 to 2 hours. So very important to know this. We have to save lives. 140 people dying every day is one too many, way too many. So I want to be your resource in rescuing these precious souls from fatal overdoses. The pandemic has made overdose rates skyrocket. And we're going to look at, from county to county, what can be done to reverse this trend. Okay, fam. Wishing you God's blessings. Don't forget to smash the subscribe, comment, like, send us to 25 your friends. And let's save lives, even if it's one at a time. This is Dr. Isaac Alexis from the Slim Samurai Group 84, helping you to slash through sickness and offering you a slice of health and wellness. Take care, fam.